How much do you think on average it costs for a baby to stay in the NICU for just one day? It's about $3,000. So you can imagine being a parent in this situation, the eagerness that you'd feel to have your baby healthy and on their way home as soon as possible. Neonates have an increased chance for any type of infection in the NICU. The most common are bloodstream infections, which are also the most common nosocomial infections, or one acquired in a hospital setting, especially in NICUs. So you may be wondering how this applies to you or your life. Well, if you're planning on having kids in the future, like I am someday, I'm here to tell you that this happens to anyone for any reason. A statistic shows that 10 to 15% of all babies born in the United States yearly end up staying in the NICU. I myself am a nursing major and plan on going into neonatology once I graduate with my BSN. Today I'm going to tell you what bloodstream infections are, the main causes of them, and the treatments and preventions involved. So bloodstream infections, as we stated, are highly likely in the NICU, and neonates have a higher risk for infections when they stay there. But before we get into the risk factors that can increase the chance of bloodstream infections, let's discuss what they are. They're defined as an invasion of bloodstream by bacteria. This can be through a wound, surgery, injection, infection, or catheters. If these are overlooked or not treated correctly, they can lead to septic shock or other life-threatening conditions. So now let's look deeper at the risk factors that can increase the chance of bloodstream infections in neonates. Low birth weight, prematurity, congenital malformations, long or frequent hospital stays, and catheters can all do this. So the most common factor that we're going to look at are catheters. And catheter-related bloodstream infections are defined as ones diagnosed in neonates with intravascular catheters present and no other source of infection identified, such as respiratory, gastrointestinal, or urogenital tract infections. These are common in the NICU because most babies staying there require catheters to provide life-sustaining treatments. So now that we've introduced ourselves to what bloodstream infections are and the factors that make neonates more susceptible to them, let's find out how and what causes them. So when you think of infection spreading, do you imagine sneezing, contact with body fluids, coughing? These all spread infections, but when we look at bloodstream infections specifically, they get contracted differently than your everyday cold. The most common we're going to discuss today are catheters. Most neonates need them for intravascular medications or nutrients. These catheters provide life-sustaining treatments, and unfortunately, these devices are also the main cause of bloodstream infections. So how do the catheters become infected? Bacteria that entered the body through the ways we talked about earlier, such as wounds, surgery, injections, infections, and catheters, attach to the walls of catheters. They grow rapidly and build up, and eventually small pieces of the infection break off and travel directly to the bloodstream. These cause serious infection and spread easily to the rest of the body. So, infected catheters are extremely common because they are constantly present within the body. Internal catheters remain in place throughout the whole treatment and are never changed. The external portion of them are cleaned and changed regularly, but without proper care can be the source of infection. These bloodstream infections are often not caught in time or overlooked in the beginning and can lead to septic shock, mortality, long-term neurodevelopmental impairment, and even death. So in addition to the several sources and causes of bloodstream infections, it is important to understand what treatments and preventions are involved. So bloodstream infections often result from poor catheter placement and care technique from healthcare workers in the NICU. And most specialists agree that preventions should be the top priority rather than once the infection occurs, treating it. So many preventative techniques that require extra training and practice, and some that don't, have been identified. Healthcare workers can take extra training and practice courses for insertion guidelines of catheters, prophylactic administration of antibiotics, and application of skin emollients, which decrease surface bacteria around the catheter insertion site. Family and any guests visiting the neonate also play a crucial role in prevention of bloodstream infections. This requires no training or practice, but does require the dedication of the healthcare worker to ensure that the family and visitors perform and have knowledge of these. The first is breastfeeding, and the mom will introduce her antibodies naturally to the baby, which can help build the weakened or underdeveloped immune system. The second is ensuring gowning of every visitor to decrease the bacteria that's introduced to the neonate. So the advancements of research in discovery and prevention of bloodstream infection is almost non-existent. Current studies focus more on the specific bacteria that causes bloodstream infections and how they're spread. But many specialists theorize that sooner discovery and complete prevention would be the best way to stop these bloodstream infections. For example, Mohan Pami quoted in his article, Catheter Biofilm Microbiome in Infected Neonatal Catheters, that earlier detection may enable earlier targeted therapy and may facilitate preservation of catheters in this vulnerable population. So after that look at treatment and preventative strategies, let's recap on what I've informed you of today. So to sum things up, as we stated earlier, preemies are highly susceptible to bloodstream infections. So to refresh your memory, bloodstream infections are an invasion of the bloodstream by bacteria. Now remember, the main causes we went over include surgical procedures and internal factors, but the main one we focused on were catheters. And the last thing we discussed were most specialists agreeing that preventative strategies should be the top priority rather than waiting for the infection to occur to treat it. This will increase the chance of survival for neonates, and anything that we can do that will increase their chance of survival is worth extra training, practice, and care, because these babies are already persevering with the odds stacked against them. And the goal of all staff in the NICU and families of these neonates is for the baby to live.